This cow was presented with severe feet engorgement and suspected food poisoning after consuming excessive spoiled or indigestible feed. Food poisoning in cattle may occur due to contaminated feed, fungal toxin, sudden dietary change, or overeating of fermentable materials. In some cases, poor quality feed and empowerment for management can also lead to indigestive disturbances and ruminal overload. Affected animals commonly show signs such as loss of appetite, abdominal distension, excessive salivation, dullness, discomfort, and difficulty in rumination. The animal may stop eating completely and become weak and dehydrated. After proper treatment and supportive therapy, the animal gradually started recovering and resumed normal feeding behavior. Treatment in this case included administration of sodium with normal saline to help reduce toxicity and support rumen function. Detox vet also provide to neutralize toxin and improve metabolic recovery. Appetizer and digestive stimulant therapy were also administered to stimulate appetite and restore normal digestion. After recovery, the cow started eating normally and showed gradually improvement in overall condition.